Hello, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers, and today we're diving into an essential topic, the 10 early warning signs of neuropathy. We want people to be able to identify the early warning signs before it progresses too far. We've had tremendous success treating this condition, and the sooner you identify and treat it, the better. If you've ever felt tingling in your hands, numbness in your feet, or unexplained discomfort that just doesn't seem right, these could be early clues of neuropathy, a condition that affects millions but often goes unnoticed until it's advanced. Neuropathy can stem from various causes, and catching it early can make a significant difference in managing symptoms and preventing complications. Over the next 10 minutes, we'll walk you through these signs, explain why they happen, and share practical steps you can take if you notice them. Stay with us. This knowledge could be a game changer to you or someone you care about. Let's get started. Before we explore the signs, let's clarify what neuropathy is and why it matters. Peripheral neuropathy occurs when the nerves outside your brain and spinal cord, known as the peripheral nervous system, become damaged or dysfunctional. These nerves act like the body's communication network, relaying signals for sensation, muscle movement, and autonomic functions like digestion and sweating. When they're compromised, it's like static on a phone line. These nerves act like the body's communication network, relaying signals for sensation, muscle movement, and autonomic functions like digestion or sweating. When they're compromised, it's like static on a phone line. Signals get distorted or lost, leading to a wide range of symptoms. Common causes include diabetes, which is the leading trigger, as well as vitamin deficiencies, particularly B12, autoimmune diseases, infections, or even physical trauma like repetitive strain injuries. Certain medications, such as chemotherapy drugs, can also contribute. The challenge with neuropathy is that early signs can be subtle, often mistaken for normal aging or temporary discomfort, but ignoring them can lead to irreversible nerve damage. By understanding these signs, you're taking the first step towards proactive health management. Let's dive into the first sign. To be upfront, this is the typical presentation of neuropathy, and sometimes the body doesn't read the textbook. Not every case of neuropathy presents this way. The first sign is a tingling sensation, often described as pins and needles, most commonly felt in the feet, but can also be felt in the hands or sometimes the legs. This sensation, known as paresthesia, is one of the earliest indicators of neuropathy. You might recognize it as that feeling when your foot falls asleep after sitting cross-legged too long. But with neuropathy, it happens without an obvious cause and may persist or recur frequently. This occurs because damaged nerves send erratic signals to your brain, creating a false sensation of tingling. For some, it's mild and occasional. For others, it can feel like a constant buzz or prickling. If you notice this in both hands or both feet, known as a symmetrical pattern, it's a red flag. Start by tracking when it happens. Is it worse after certain activities, like standing for long periods, or at night? Symptoms worse at night are a sign that this is likely a circulation issue. Keeping a symptom journal is a valuable tool to identify the cause of your symptoms and track their progression. Neuropathy is a progressive condition that can worsen gradually, often so slowly that you may not even notice how severe it has become over time. Also, check your footwear. Tight shoes can worsen symptoms. Although if your same shoes are getting tighter, this may be a sign of your feet swelling, which needs to be evaluated as well. If tingling is happening regularly, it's time to consult a healthcare provider to explore underlying issues like diabetes or nutrient deficiencies. Sign number 2 is numbness, or a reduced ability to feel sensations. You might notice that you don't feel hot or cold as well as before, or you don't feel minor injuries like stepping on a small pebble or getting a blister. This happens because sensory nerves responsible for transmitting touch and temperature signals are no longer functioning properly. Imagine trying to text on a phone with a cracked screen. Some inputs just don't register. This numbness is particularly concerning for people with diabetes, as it increases the risk of unnoticed injuries that can lead to infections or ulcers. particularly on the feet. For example, a small cut might go unnoticed because you don't feel it, leading to serious complications. We've had patients who've come to our office with cuts and blisters, and they had no idea they were there. One was so severe, we had to refer him to urgent care prior to being able to start treatment. To stay proactive, inspect your hands and feet daily for cuts, bruises, or redness, and use a mirror to check hard-to-see areas. If you're experiencing numbness, avoid extreme temperatures like hot baths or icy surfaces. This symptom warrants a medical evaluation to assess nerve function and rule out treatable causes. Sign number 3 is a burning or painful sensation, often concentrated in the feet or the hands. It might feel like your skin is on fire or as if you're walking on hot coals, even when your feet are comfortably on the floor. This discomfort can range from mild to severe and may come and go or intensify at night, disrupting sleep and creating a whole host of other issues. In another video, we explain in more depth what happens, but short story is that at night, the blood flow to the nerves decreases, so they're getting less nutrients and oxygen. This causes the nerves to misfire, aggravating symptoms. Unlike typical pain from an injury, this burning is caused by hypersensitive nerves that send pain signals to your brain without a clear trigger. It's like a faulty alarm system going off for no reason. This symptom is common in diabetic neuropathy, but can also stem from vitamin B12 deficiency, alcohol-related nerve damage, or other conditions. If you're experiencing this, try soothing strategies like cool, not cold, foot soaks, or wearing loose, breathable clothing to reduce irritation. However, these are temporary measures. Consulting a healthcare provider is crucial to identify the root cause and explore treatments, such as medications or lifestyle changes, to manage pain and prevent progression. If this burning sensation sounds familiar, note when it's worst and share that with your doctor. Sign number 4 is muscle weakness, which can make everyday tasks surprisingly difficult. You might struggle to grip a coffee mug, open a jar, button a shirt, or you may feel unsteady when climbing stairs or walking. When you pair this with decreased sensation, you may find it very difficult to pick up small objects like coins, buttons, or screws. This happens when motor nerves, which control muscle movement, are affected by neuropathy, reducing their ability to send clear signals to your muscles. It's as if the connection between your brain and muscles is lagging, like a slow internet connection. This weakness can develop so gradually you might attribute it to aging or a lack of exercise, but it's a key warning sign. For some, it starts in the hands, affecting fine motor skills, while for others, it's in the legs, making walking feel labored. You may even notice your legs feel heavy. To address this, gentle strength exercises under a doctor or physical therapist guidance can help maintain muscle function, but don't ignore it. Persistent weakness could indicate progressive nerve damage. A medical evaluation, possibly including nerve conduction studies, can identify the extent of the issue and guide treatment. A medical evaluation, possibly including nerve conduction studies, can clarify the extent of the issue and guide treatment. Including nerve conduction studies can clarify the extent of the issue and guide treatment. Sign number 5 is difficulty with balance or coordination. If you're tripping more often, wobbling when you stand, or relying on walls or furniture for support, neuropathy might be affecting your proprioception, your body's ability to sense its position in space. Healthy nerve signals constantly send feedback to your brain about where your limbs are, allowing smooth movement. When these nerves are damaged, it's like navigating with a faulty Jeep, leading to unsteadiness. This is especially risky for older adults, as falls can cause serious injuries like fractures. While many people are concerned about an amputation from neuropathy, falls are actually the biggest risk. You might notice this when walking on uneven surfaces or in the dark when visual cues are limited. One thing that I've seen with patients over the years is the earliest warning sign is difficulty showering, especially when closing your eyes. To reduce fall risks, clear your home of tripping hazards like loose rugs, use grip pads in the shower or bath, and consider balance exercises such as standing on one leg while holding onto a chair, but only with medical approval. These exercises can be very helpful, but if the nerves sending your body this information are damaged, the benefit will be minimal. If balance issues are new or worsening, see a doctor promptly to assess nerve function and explore causes like diabetes or vitamin deficiencies. Sign number 6 is a heightened sensitivity to touch known as allodynia. Normally harmless sensations like a bedsheet brushing across your feet or a light touch to your arm can feel intensely painful. Some patients we've seen have told me they can't even sleep with a sheet covering their feet. If you remember from earlier about the cause of increased symptoms from decreased blood flow at night, this makes sense. As for what's happening, imagine your nerves are a radio with the volume up high, amplifying every signal into discomfort. This occurs when damaged sensory nerves misinterpret gentle stimuli as threats, sending exaggerated pain signals to your brain. Allodynia can be debilitating, making it hard to sleep or wear certain clothing. For example, socks or tight shoes might feel unbearable. To manage this, try loose, soft fabrics and avoid extreme temperatures, but these are only stopgaps. This symptom often indicates more advanced nerve irritation, so it's critical to consult a healthcare provider. Topical treatments can be helpful to calm overactive nerves, but you still need to get to the core of the problem. Sign number 7 is muscle cramps or twitching, known as fasciculations. You might experience sudden involuntary muscle spasms or a fluttering sensation in your legs, arms, or even smaller muscles like those in your hands. These occur when motor nerves misfire, sending erratic signals to your muscles. While occasional cramps from dehydration or overexertion are normal, frequent or persistent episodes, especially alongside other symptoms, could point to neuropathy. For instance, you might wake up with a painful calf cramps or notice your fingers twitching during rest. To ease cramps, ensure you're well hydrated and consider stretching exercises. Blood tests for nutrient deficiencies like magnesium or potassium or nerve studies may be needed to uncover the cause. If these symptoms are disrupting your daily life, don't dismiss them as just cramps. They could be a clue to underlying nerve damage. Sign number 8 involves changes to your skin, hair, or nails, which might seem unrelated but can signal neuropathy. You might notice excessively dry or cracked skin, particularly on your feet, reduced hair growth on your legs, or nails that become brittle or discolored. Loss of hair on your hands or feet is a very concerning sign and needs to be addressed. These changes stem from lack of blood flow causing autonomic nerve damage, which affects involuntary functions like skin hydration and hair follicle health. Think of autonomic nerves as the body's backstage crew, managing things so you don't consciously control them. When they're impaired, these subtle changes appear. For example, dry skin might lead to cracks that invite infection, especially in diabetic neuropathy. While only temporary, a gentle moisturizer daily may help, and make sure to check for wounds, but don't stop there. If you're seeing these changes alongside other signs like tingling or numbness, discuss them with a doctor to explore nerve-related causes and prevent complications. Sign number 9 is digestive problems, which can be an unexpected sign of neuropathy. You might experience bloating, constipation, diarrhea, or a feeling of fullness after eating small amounts. Some people also report nausea or difficulty swallowing. These issues arise when autonomic nerves that regulate digestion are affected, slowing or disrupting gut motility. It's like a traffic jam in your digestive system, causing discomfort and irregularity. This is particularly common in diabetic neuropathy, but can also occur in other forms. If you're dealing with unexpected digestive changes, especially with other neuropathy symptoms, keep a food symptom diary to identify patterns. Staying hydrated and eating high-fiber foods may help, but these are only supportive measures, not cures. A healthcare provider can order tests to assess nerve involvement and recommend treatments to improve digestion and comfort. Finally, sign number 10 is trouble regulating body temperature. You might find yourself sweating excessively, even in cool weather, or struggling to stay warm when others are comfortable. When people notice reduced sweating in certain areas like the feet, leading to overly dry skin. These issues reflect autonomic nerve damage, which controls sweating and blood flow to regulate temperature. It's as if your body's thermostat is malfunctioning. This can be subtle but disruptive, affecting your comfort and even your sleep. For example, night sweats might wake you up, or cold hands and feet might persist despite warm clothing. To manage this, dress in layers and avoid extreme temperatures, but prioritize seeing a doctor if this is paired with other symptoms. Tests like autonomic function studies can help confirm neuropathy and guide treatment to address the underlying cause. There you have it, The 10 early signs of neuropathy, from tingling and numbness to digestive issues and temperature regulation challenges. Each of these symptoms is a signal from your body that something may be amiss with your nerves, and recognizing them early can empower you to seek timely care. If any of these signs feel familiar, don't wait. Schedule an appointment with a healthcare provider to discuss your symptoms. They may recommend tests like nerve conduction studies, blood work to check for diabetes or deficiencies, or imaging to rule out other causes. Early intervention can slow progression, manage discomfort, and improve your quality of life. For more health insights, subscribe to our channel and share this video with someone who might benefit. If you've noticed any of these signs and are looking for a drug-free, non-invasive approach to reverse your neuropathy, please contact us to see if we can help.